Hi everyone, welcome to Facebook Live. I'm Dr. Ryan Gocke, and today I will be talking to everyone about neck pain and problems with the cervical spine. So I am a orthopedic spine surgeon with OrthoVirginia, and I currently practice at the Boulders office next to Chippenham Hospital. For many of you who may not know, OrthoVirginia has offices at multiple locations in the Richmond area, and we also have offices in Northern Virginia as well as Lynchburg and Virginia Beach. So I am here in Richmond today, and the weather looks pretty good. It's a little cloudy, a little warm, but all considered, we're doing just. So I was a military orthopedic surgeon for about 10 years prior to joining OrthoVirginia, and I practiced in Virginia Beach at Portsmouth Naval Hospital, and I treated multiple active duty military personnel, Marine Corps, infantry guys, Navy SEALs, U.S. Special Forces, and I saw all kinds of people and problems related to the cervical spine. So really today I just wanted to kind of give everyone the opportunity to ask me some questions with regards to their neck problems, or maybe questions that they may have in general, and we will start that Q&A session here in a few moments. A couple of points that I wanted to discuss with regards to neck problems. It's really something that can affect pretty much all and any individual at any point in time. Pretty much everyone during their adult lifespan will deal with some degree of neck discomfort at some point or another. Typically, patients who I see most frequently are those that do manual labor, but certainly I see a lot of patients who do more sedentary activities, who may work a desk job, who also have chronic neck problems and a lot of pain and dysfunction simply from working in front of a computer. So it's important to understand that really no one is completely immune from developing neck problems as they progress along in life. Certainly the vocation or what an individual does for a living plays into how much neck discomfort they can have. Also, certainly genetics is a big component. If a family member has a neck problem, that probably puts you at higher risk for developing cervical issues or issues around the neck. And certainly aging can be a big thing as well. As we progress along in life, the muscles, the tendons, the ligaments, the bones in our neck can wear out, and that can predispose us to problems. So one of the things I think we should briefly discuss before moving forward is the more common symptoms, and I bet with everyone who's watching right now, they probably already know those symptoms. I would say the most common complaint that I get is neck pain and stiffness that radiates into the top of the shoulders. A lot of patients come in and they'll describe a tightness or a feeling in their cervical spine or in their neck that prevents them from being able to turn their head one way or the other. And for many of the patients, it's typically symptoms at nighttime that brings to their attention the fact that they may have an underlying problem that's more serious. Certainly patients who have radiating pain that goes into the shoulder blades, usually it's in the back of the shoulders, but not always. It usually will start in the neck and radiate towards the shoulder blades, and if it's severe enough, it'll go all the way down the arms. It's not uncommon for patients to have numbness, tingling, and even weakness. I see a lot of patients who come in and they look at me and they say, "Hey, Dr. Gocke, I can't use my hands anymore. I've got numbness, tingling. I'm dropping objects. I'm dropping my coffee cup in the morning, or I have difficulty buttoning my shirt and doing certain activities that for most people otherwise are pretty simple to do." So another big complaint that I see is patients who come in and they've got neck discomfort, but they also will say that they've got headaches. And those headaches for a lot of people can be really, really debilitating. It can disrupt their sleep pattern. It can really interfere with their ability to concentrate during their workday. They can't be as productive at work. And usually it's pain that starts in the neck that radiates to the back of the head. If it's severe enough, it can also go towards the front of the head, but usually it's in the back, but not always. Certainly I see patients who also come in and they'll say, hey, Dr. Gocke, I've got pain in my shoulders that radiates down my arm, but I also feel pain that shoots down my spinal column, and it'll go towards my tailbone sometimes. And a lot of those patients, they'll have a more severe, more significant underlying problem. They can also have issues with balance when they walk. They can also have difficulties with bowel and bladder function. And so it's really important to understand that for most of my patients who I see who have neck problems, a lot of them will have an underlying neurologic issue whereby the nerves in their neck are becoming compressed. So I think that's a good segue into discussing what are the underlying causes. In other words, what are the problems that are happening to somebody's cervical spine that can cause them to have these types of symptoms. And I actually brought a little model here. I don't know if everyone can see this really well. I hope so. But usually when I see patients, and it's usually when they get into their 30s, 40s, and beyond, they have what we call disc degeneration, whereby these little shock absorbers here can start to wear out and the spinal column can literally start to collapse down. The discs themselves, the cushions, can start to wear out and collapse down. And that in and of itself is enough to cause localized pain and discomfort. So if I see a patient who has a lot of neck pain, oftentimes it's an underlying disc degeneration problem. Sometimes I'll see patients who, they've only had neck discomfort for, let's say, maybe a couple of weeks, 2 or 3 weeks, and maybe they report a history of being involved in an accident, or maybe they report, moving furniture at their house several weeks ago, and they pull a muscle in their neck. That's really not what I'm talking about. Those patients typically improve over time within a few weeks just by some rest and activity modification. Usually those patients will, if it's a muscular problem whereby they pull something in their neck, they'll start to see improvement pretty soon after it happens. The patients who have the disc degeneration whereby the cushions are wearing out, that's more of a chronic problem, and those patients will typically come in and tell me that they have an existing issue that's been going on not for weeks but for months at a time. So with younger patients, I can also see what's called disc herniations. Disc herniations are not unique to the cervical spine. They also happen in the middle of the spinal column and also in the lower back, probably more commonly. But a disc herniation is simply a process whereby the jelly that's inside of these cushions squirts out, and literally it pushes on a nerve. And the nerves in your neck, they all exit out and they go into your shoulder blade and they travel down your arm. If those nerves are compressed from a disc herniation significantly enough, patients will feel nerve symptoms down their arm. They'll report a burning sensation. They will report a Charlie horse or a dull, burning, achy sensation, usually in the shoulder blade. And if it's been severe enough, they'll feel weakness in their arm. Usually it's a problem that's isolated to 1 or 2 fingers. They'll feel numbness that radiates down their arm into a couple of their fingertips, but not always. And usually those patients will also feel weakness in one of their muscle groups in their arm. So for example, their tricep muscle. They'll look at me and they'll say, hey, Dr. Gocke, I like to go to the gym, and I've noticed over the past couple of weeks my arm is hurting, I've got numbness, and oh, by the way, I can't bench press as much because my right arm is weaker. So that is a very telling story that helps to show or tell me what's going on with regards to their neck. The disc herniation problem is more common, I would say, in patients who are 50 years of age or younger. Also with the disc degeneration over time, as patients get into their 50s, 60s, and beyond, the space available for the nerves as the nerves exit out of their spinal column can become compromised. And so what we see is a mechanical compression or squeezing of the nerves that exit out of the cervical spine. That's, again, typically more common in patients who are 50 years and older, but not always. And those patients who have that particular problem, that's been going on usually for months and months and months. It's not a sudden onset or a new problem that I could sometimes see with patients who have had disc herniations, which typically presents relatively quickly. So, and we call this particular problem stenosis. This is also related to these discs in the spinal column wearing out and collapsing down. And so this mechanical downward pressure causes these patients to feel the nerve discomfort. It's similar to a patient who has a disc herniation, but it's a more chronic problem, and they also will have pain, numbness, tingling, weakness that radiates down the arm. If it's severe enough, again, they can feel it in their lower extremities or down their spinal column, down towards their tailbone. The last underlying, or the last group of problems or issues that I see with patients who have neck issues is what we call central cervical stenosis or cervical myelopathy. This is a particularly concerning problem that I see for usually my older patients. And what it means is that there's bone spurs that have become so big in their spinal column and around their neck that their spinal cord itself becomes compressed. The space available for the spinal cord, which travels from their brain down their spinal column, has become severely compressed and stenotic. Those patients will start having issues with clumsiness in their hands. They will tell me that they can't really do much with regards to fine motor tasks. So let's say buttoning their shirt is really difficult for them to do. Picking up coins off the table. Anything that involves fine dexterity or use of the fingertips becomes really, really, really difficult for these patients. Certainly, a lot of them will present as well, and they'll tell me, they'll say, "Hey, Dr. Gocke, I've had this problem with my neck. I've had chronic neck pain for many years, but now I'm noticing that my balance is off. I can't walk as well as I used to. When I walk a straight line, I feel like I'm a little bit unsteady." And that oftentimes means, again, that their spinal cord has become severely compromised and it's becoming squeezed. So looking at the treatment options for all of these problems, it's hard to put all of them together into one treatment pool, but generally speaking, the patients who have had symptoms for a short period of time, let's say less than a month, they're going to respond pretty well to the non-surgical options, to include things like taking over-the-counter anti-inflammatories. So something simple like Advil or Tylenol can work really well to help out neck discomfort for a lot of patients. Certainly activity modification is a big one. What does activity modification mean? If you're a manual labor, maybe taking some time off work is perhaps a good option. For a lot of people, taking time off work is not a possibility, so perhaps maybe talking to your employer and finding out a different job set or a different task that you can complete at work may be an option for you. Certainly the old-fashioned remedies of ice and heat being applied to your spinal column or to your neck is going to be helpful for most patients. It won't typically solve all your problems, but it certainly can make you feel better. And what I tell my patients is use heat in the morning when you're waking up, and then put ice on your neck at nighttime when you're finishing up your day. Also in the realm of activity modifications, I see a lot of patients who they come in and they say, "Hey, Dr. Gocke, I work a desk job, and what I've noticed is, the first hour I'm fine, but after the second or third hour, from being in front of the computer and typing, my neck and my shoulders start to get really tight and becomes really uncomfortable." Believe it or not, a simple solution is a standing desk. So if you can find access to a standing desk at your workplace, possibly maybe ask your employer to buy one for you. Maybe if you can afford it, buy one yourself. but simply changing positions from a seated position to a standing position while you're working throughout the day can really, really help out a lot of patients who have neck discomfort. So that's kind of the more individual self-directed treatment options. Beyond that, you kind of get in the realm where you have to maybe come and see me and talk to me about some options. The basics here would be when I see a patient who hasn't really tried anything in the past or hasn't seen a physician before, the basic options that we pursue are physical therapy and medications. Excuse me. Physical therapy, there's different modalities, and each therapist will change the way they do things to help an individual out. But basically, you're looking at having a therapist work with you with regards to your strengthening around your neck, your flexibility. They will do specific modalities such as traction therapy. Believe it or not, a traction device is a device that actually puts a little traction on your neck and stretches everything out, and that can help out a lot of patients with their neck problems. Certainly, massage therapy is something that a lot of physical therapists will do. Massage therapy feels really great when you're having it done, but maybe the effects won't last long term. Acupuncture or dry needling, I would say a lot of physical therapists can also do. Acupuncture and dry needling is the process by which they stick little tiny needles around the muscles in your spinal column, and that can sometimes alleviate muscular pain. It won't solve the nerve problem, but typically a lot of times patients who have the nerve problems, they will also have muscle pain and discomfort and spasms in the muscles, and so these physical therapy modalities can help them out. Medications is definitely something that works really well for a lot of patients. I do see a lot of patients, they come in and they say, hey, Dr. Gocke, I've had this neck problem for quite some time and medications do help me, but I don't really want to take medications. And that's okay, but I would say to most patients that be open to the idea of at least taking some pain medications when you need it. If you're having a really bad day, or if you know you're going to be at work and you're going to be there for a long period of time, take a medication that potentially can give you some significant relief. The three meds that we use, or that I use, that I prescribe typically are muscle relaxants, which again, they target more of the muscles. Obviously, they're muscle relaxants, and they can help out with muscle spasms and cramping around the neck and into the shoulders. There's nerve pain medications. We call them gabapentinoids, and the one that I use typically most frequently, and many of my colleagues use, is called gabapentin. And that medication really helps out with nerve discomfort more than anything else. So if I see a patient who has persistent nerve pain into the shoulder or down the arms, they're going to be probably a good candidate to take some gabapentin. And then last, I will sometimes, not very frequently because of the side effects, but I will sometimes give a patient narcotics to help manage their pain. Oftentimes patients who can't sleep at nighttime, if they're having a lot of difficulty, I can help them with a light narcotic. That's not something I like to give out to the majority of my patients, but I will do that periodically. So moving beyond physical therapy and medications for treatments, the next line would be what we call epidural or steroid injections. The steroid injections are designed specifically to place steroid medication, down by the nerves. The steroid medication is a very, very potent anti-inflammatory medication. It doesn't remove any pressure. It doesn't remove the mechanical pressure which may be on the nerve, but certainly it can calm down inflammation. And oftentimes for many of my patients, it's inflammation in addition to the mechanical pressure on the nerve which is causing their problems. So the majority of patients, I would say, who receive these epidural steroid injections will get better. They may not have persistent relief for months and months and months, but if they're having let's say a bad few weeks and they want to try something that's a little bit more invasive than what they've done before, the epidural steroid injections are a great option. The steroid injections are reserved for only those patients who do not have severe spinal cord compression. So just so everyone knows, if you were to come in and see me and you said, hey, Dr. Gocke, my spinal cord I'm having neurologic problems, and I looked at their MRI and I said, well, your spinal cord is getting compressed, usually steroid injections are not a good option for those patients because over time they can develop bigger problems. So last but not least, I'm a surgeon and I do surgery all the time. I would say my area of expertise is in fact the cervical spine. That's what I enjoy doing the most, and I would say that that's what the majority of my patients come and see me for. Surgery works well for treating all of these problems that I've mentioned. Certainly if you have a neurologic disorder or a problem with neurologic compromise whereby the nerves in your neck are becoming squeezed, oftentimes surgery is going to be the only option that can definitively fix the problem. It's important to understand, however, if you come and see me, I'm not going to start talking to you about surgery right away. Usually I will push my patients toward the conservative route first, and that conservative route usually works well over 60 to 70% of the time for the majority of patients. So if you come and see me, chances are I can help you without cutting on you. But in the event that the problem persists and you feel like your quality of life hasn't really improved and you feel like maybe things are getting worse, the surgical options that I can provide will really provide a lot of benefit to you and give you good relief. And usually we can restore function. I can take a nerve problem and reverse it usually and make you better from a surgery. So I think with that said,
yeah, we have some questions.
Open it up for questions. I hope that I didn't answer all the questions, but perhaps we've got some viewers who can ask me something else.
Absolutely, you did.
Or ask me about something that I've talked about. Whatever you would like to do.
No, you did cover some of the questions about ice versus heat, which that came in, and also about the steroid injection. So you already covered a couple. But one of the questions is, I have a tingling pain and sometimes numbness from my neck down my left arm that sometimes goes away. Is that a sign that the spinal or neck disorder is getting better, or am I just dealing with the pain?
Great question. So I get this a lot. So I see patients who they have the numbness and tingling going down their arm, and they say, and I explain to them why it's happening. Usually it's because of mechanical pressure on the nerve, and they say, well, Dr. Gocke, if I have that mechanical pressure on my nerve, why does it come and go? And there's two reasons behind that. Number one is positional. So how you sleep at nighttime, how you position your head and neck during the day can affect how the nerves in your spinal column are being compressed. So that's usually the clearest answer. However, there are a lot of patients whose nerves, believe it or not, can adapt to the mechanical compression. So they may develop the numbness and tingling down the arm, but the nerves have a blood supply, and the nerves are living tissue, and there's living cells there, and those cells in that living tissue can adapt. And so that adaptability explains why a lot of patients over time will get better with this particular problem.
Okay, thank you. The next one. I am seeing a chiropractor for neck pain. I have limited movement and x-rays have been taken. I have disc and spur issues. Should I see a second opinion, or should I seek further and get a second opinion?
Yeah, so I think seeing a chiropractor is a great option for a lot of patients. I have many patients over the years who have gone and seen a chiropractor, and oftentimes the story that I hear is that they see a chiropractor when they feel like they need to see the chiropractor, and they'll get a few treatments and they feel better, and then they go on, proceed along with life. However, as I mentioned before, if you're seeing a chiropractor and you're having neurologic dysfunction, and your chiropractor should talk to you about this, they should know this, but if you're having neurologic dysfunction, if you're having weakness down your arm, if you're having numbness and tingling, if you're having headaches into the back of your head, if you're having pain that radiates into your shoulder blades, those symptoms can all suggest that you've got a underlying neurologic problem whereby the nerves in your neck are becoming compressed. And so what I would recommend in that scenario is to definitely go and see a spine surgeon, somebody who could potentially at least order an MRI, take a closer look at your neck, and find out what's going on, and really treat you the appropriate way. Because chiropractors can do good work, but a lot of things they can't fix.
Okay, thank you. The next one. What can be done for a herniated bulging disc neck pain that has increased despite RF nerve burning, which was made worse, Lyrica for years, steroid shots, and PT? I also have spinal stenosis and neuropathy.
So, based on that alone, I would say you need to come and see me.
Sure.
So that, I mean, that sounds like a patient who, you know, you've completed all the different non-surgical routes. You've tried injections. You've tried medications. You have this persistent problem. It sounds like you probably already have an MRI. So really, you know, if this issue is affecting your quality of life pretty significantly, come and talk to me. This is something that I could potentially help you out with. Again, I'm not gonna, you know, immediately see you and start talking about surgery right away. Perhaps we can explore some different options. But based on that history alone, I think you should definitely come and talk to me.
Okay. This is from a nice gentleman who is writing on behalf of his wife who is working today.
Okay.
She has what seems to be muscle spasms in the large vertical muscle in her neck and on the back left side. Mm-hmm. She sees a chiropractor on a monthly basis, which does help temporarily, and also gets massages that help the pain for a few days, but then occurs most days. Mm-hmm. Any advice is appreciated.
So that sounds like it may be more of a muscular problem, and I can treat that. But I think, you know, for someone in that scenario, seeing a physical therapist would be worthwhile. I really do. The physical therapists they are all trained extremely well, and they will show you specific exercises and things that you can work on your own and with them that will help improve the muscular problem that you're dealing with. My experience with many of my patients with therapy is that they don't want to go because they don't feel like going 2 to 3 times per week is, you know, for extended period of time is going to solve their problem. What I tell my patients is go see the physical therapist once, twice, at least hear what they have to say. Maybe they can show you some things that you haven't done in the past and see how it goes. And a lot of times patients will do that, and they'll take what they learned from the physical therapist, they'll take it home with them, and they'll do some things on their own, and their quality of life improves.
Perfect. We've had several people asking about pillows and mattresses. So is there an importance, or do you have a suggestion about your mattress, your pillow, and your sleeping position?
So I get this question a lot, and I get the question so frequently that I wish that I had a straightforward answer for everyone. But unfortunately, there is no specific correct pillow for all people. Everyone's body is different. We're all made differently. Everyone's got a different physique. We all have different mattresses. So if patients can't afford it, what I recommend is trying different pillows out. Try soft pillows, firm pillows, you know, change the size, maybe even change the number of pillows that you sleep with at nighttime. Without a doubt, I see patients all the time who, you know, they come back and see me and follow up and they say, hey, Dr. Gocke, I changed my pillow around and it's helped out a lot. Hasn't solved all my problems, but I definitely sleep better at nighttime and I feel better during the day. So that's something that's definitely worthwhile looking into, and I think if you can't afford it, it's worthwhile to spend a little extra money trying some different options out there.
Okay, perfect. How bad does your head have to hurt before calling a doctor? I have real bad pain in the neck and the right side of my brain. I have not seen a doctor yet, but need to know, should I get an appointment? Thank you for answering my question today.
So thank you. I appreciate you coming. So headaches are concerning, and like I mentioned before, the patients who I see who have headaches that's related to an underlying neck problem, it's usually pain in the back of the head, more behind the ears. Not always, but usually. If I see a patient who's having different types of headaches, or let's say headaches in a different location, if I see a patient who is having any other types of symptoms, if they're having visual changes, if let's say they're having memory problems, balance issues, things like that, oftentimes I will refer them to another specialist to perhaps have an MRI of their brain or look more closely at their brain structure. A lot of times the headaches can vary insofar as what patients will tell me, but I kind of, we'll see an individual and I'll feel them out. And if I think that they're having an issue that's not related to the cervical spine, I will tell them and I'll send them to a different specialist.
Okay, thank you. Let's see. Sorry. Lost my screen for a minute. A loved one has regularly occurring pain in the back of the neck that seems to trigger cluster headaches. It seems to relieve pressure when I gently massage the back of the neck, but only temporarily. What can be done for this kind of pain?
So that sounds like it could be referred pain, and what that means basically is that a patient feels discomfort in one area of their body, and because of the pain they're having there, they'll have the discomfort elsewhere. And so if massage therapy makes that problem improve, typically what that would tell me is that it's a muscular problem. And so again, I would think that going to see a physical therapist would be really, really helpful. As I stated previously, the therapist can help out with underlying muscular problems. That really does not sound like a neurologic problem to me.
Okay, perfect. A couple of people have asked about arthritis being a culprit in neck pain, and do you have any suggestions about home management of arthritis in the neck?
So that's a tough one because usually the patients who have arthritis are also those patients who are more active. And it's not surprising that they have arthritis because they've been active all their life and now they've got wear and tear problems in their neck. And as I stated before, the arthritis is usually related, and I hope everyone can see this, but usually related to these discs wearing out. There's little joints in the back of the neck called facet joints, which can also become painful over time. And those structures all can cause discomfort and various types of symptoms that I've already discussed. Physical therapy is going to be really helpful and a really good anti-inflammatory. I prescribe anti-inflammatories to my patients, and they are similar to Advil, they are similar to Tylenol, but the ones that I prescribe are typically a little bit more potent and they're a little bit longer acting. So, and surprisingly, a lot of patients, they've tried anti-inflammatories in the past for arthritis, but they maybe haven't reached the right dosage or they don't take the medication frequently enough to see an effect. So the anti-inflammatories work really well for arthritis, and that's something that I could definitely help you out with. Come in and talk to me. Again, if you're one of those people who doesn't want to take medications, that's not something that we have to do, but at least we can discuss it.
Perfect. Looks like I have one, maybe two more. I have scoliosis. Is that something you can help with?
So scoliosis means curvature of the spine, and usually the majority of patients who have scoliosis will have it lower down in their spinal column. It's not in their neck, but sometimes I do see patients who have scoliosis in their cervical spine. They have done some research on this, and oftentimes patients who have curvatures don't have any neck pain whatsoever. And oftentimes patients who have curvatures do have a lot of discomfort. So I think the point that I would emphasize to you is that the scoliosis in and of itself probably is not causing the neck discomfort, but in that scenario, based on what you just asked, I would say come in and talk to me, and I would get x-rays of your neck. I would probably get x-rays of your thoracic spine and your lower back, lower down, to make sure there's no curvature there. Definitely patients who have curvatures can feel positional related pain and dysfunction in their neck. So it's important to be able to identify that and to see that underlying problem if it exists. That's a great question.
Good. Actually, I have a couple more.
Sure.
Popular questions. Does forward head posture cause disc issues?
So I don't want to get into much of a detailed biomechanical discussion about that particular question, but the short answer is yes. So patients who have postural problems with their neck can develop neck problems. And going back to my discussion about the physical therapist, they can help out with that. There's some different options there. So that's a great question, and patients who I see who work work desk jobs, they work in front of a computer a lot of the time it's postural related. And so going back to what I was saying before, maybe getting a standing desk, something like that, can help out.
You mentioned the standing desk. What about sitting on those balls that people do?
Yeah, that's a great option as well. I like to move around. I don't know if you all can see I'm fidgeting a little bit here as I talk today, but a little bit of movement is good for your spinal column. There's muscles that are supporting your spinal column, and if you can keep those muscles engaged while you're sitting down, and a little bit of motion probably will make you feel better. So certainly that's a pretty cheap option, I think. Those bouncy balls aren't too expensive, and perhaps having one at work would be a good option for you.
Okay, perfect. I feel pinched and constantly must crack my neck to get relief. What is this a problem or symptom of?
So the cracking in the neck in and of itself is probably not anything that's concerning. Our body parts crack. For a lot of us, I can make my hands crack, my knuckles, and cracking and popping is a normal thing that happens with motion. However, again, if it's accompanied by other symptoms like the numbness, tingling, like neurologic weakness, anything else above and beyond just the cracking and popping, then that can mean that you've got degeneration or wearing out of the structures in your cervical spine. And perhaps coming in to talk to me might be a good thing.
Okay, perfect. Looks like the last question is neck issues. I have neck issues where I occasionally can't turn my head. I was diagnosed as torticollis. Would you recommend chiropractors or physical therapy, or coming to see you?
So I would definitely, torticollis, there's a number of reasons as to why torticollis can happen. The most common problem is related to a muscular strain, and so therefore I think it would definitely be worthwhile to go see a physical therapist and or a chiropractor. I think that could be really beneficial for you. Doing that for a period of time, not more than 2 to 3 weeks, you should start to see some improvements. If you don't, come in and talk to me at that point in time.
Okay, perfect. Well, that was the last question that we had, so thank you very much.
Thanks everyone for coming, and I appreciate your time today. Please pass this Facebook link along to your friends and family members. So, thank you for watching, and stay safe, wash your hands, and practice safe social distancing. Appreciate it.